Osteoarthritis cases are on the rise quite dramatically. Over the last 25 years, there's been about a 20 million individual increase in the United States. Over the next 10 years, they're expecting another 20 plus million people to be diagnosed on top of our current figures. So you are definitely not alone in your struggles. This is one of the most common degenerative diseases in the United States. In fact, out of all types of arthritis, osteoarthritis is by far the most common. It affects almost 10 times as many people as rheumatoid arthritis, which you might find to be quite surprising because when we turn on the television, most of the commercials we see for arthritis medications are for rheumatoid arthritis, like Enbrel, or for psoriatic arthritis, not for osteoarthritis, even though it's much more common. And that's because osteoarthritis has a mechanical component to it. It's not something that can be easily fixed with a pill or a quick fix, if you will. So osteoarthritis, aside from being the most common form of arthritis, is often referred to as wear and tear arthritis. And most adults over 50 years old have active osteoarthritis with some type of pain or loss of function. I found over the years in looking at thousands of x-rays throughout the facilities we work with that most people 35 and older actually have some early signs of osteoarthritis. And osteoarthritis actually starts out as what I like to call a drying problem, because before you have loss of your cartilage and destruction of the bones and hard tissues, there's a fluid-filled capsule called the synovium that is your first line of defense and cushioning and lubrication of the joint. And the dysfunction begins there before these hard tissues ever become damaged. So why the knee? Well, we've been using it regularly since we were about a year old and started walking. It bears about 80% of our body weight on a daily basis. Osteoarthritis can be exacerbated and happen early onset because of injuries like the sports injury that I suffered from, or if you're in an auto accident and hit the steering wheel or dashboard, if you have a big fall and your knee hits the concrete, or even from accumulation of little micro traumas like bumping your knee on a coffee table can damage the synovial the little glands that produce the hyaluronic acid and synovial fluid inside that joint capsule. As we age, the more mileage we put on our knees, the more likely we are to have dysfunction. The more we weigh, the more likely we are to develop dysfunction because we're putting a greater load over time on the joint. And then also deformity. If you've ever heard the term knock-kneed or bow-legged, that is kind of the common speak for a varus or valgus deformity. And you see our knees commonly fall out of alignment. About 85% of people have a medial loss of joint space and misalignment. About 15% have a lateral or external loss of joint space and alignment on the outside aspect of the knee. So I like to use automotive analogies. They tend to be very relevant to the problem that we're suffering from with the knee. And if you've ever had a car where your alignment went bad, you've noticed that you go through tires really quickly because you have an uneven wear. If you're asking just part of that tire to bear the entire load versus the entire surface area, it fails much more quickly and will eventually lead to a blowout if you don't fix that alignment issue. Well, our knees are not extremely different from that. They can bear weight very effectively. It's what they were designed to do. They can go front to back for a long, long time without a problem. It's once you start introducing an uneven load or rotation or sheer lateral movements that the knee begins to fail. And that's why in sports, you see most of the knee injuries are not from a head-on impact or collision, but from a side impact or collision, because the joint's not designed to bear as much stress and weight on that angular plane as it is on a front to back motion. So let's look at an anatomical drawing of the knee real quick, just to talk about some of the normal structures. This triangular shaped thing you see here is your patella or your kneecap. And it's designed to ride in between this channel here, in between the femoral condyles, much like how a sliding glass door goes smoothly on its track. But if it ever falls out of track, it can grind and be very difficult to move. Your kneecap is not much different than that. This white substance you see here surrounding the end of the bones is called hyaline or articular cartilage. And that's designed to protect the blood vessels and nerve endings that wrap the bones and keep them from becoming exposed and damaged. In between the joint, you've got a meniscal soft cartilage, and then you also have this synovial fluid that will cushion and lubricate the joint, allowing it to glide next to each other. You see, when all of our joints are working properly, from our fingers to our toes,